The Institute of World Affairs at the University of Wisconsin-Milwaukee presents International Focus, a weekly discussion of the people and events behind today's global headlines. Support provided by Milwaukee Public Television and the UWM Center for International Education. Now here's your host, Rob Ricigliano.
Welcome to International Focus. Our topic today, the economics of HIV/AIDS in Malawi. The World Health Organization estimates nearly 35 million people worldwide are living with HIV. The majority live in sub-Saharan Africa. As the clinical battle against this deadly disease continues in the laboratory, practitioners in a variety of disciplines are taking the fight to the field, exploring the link between HIV, vulnerability, and factors such as poverty and food insecurity. One such project is underway in rural Malawi, where researchers from UWM are examining how economic factors impact the spread of the disease in that nation. Joining us today to provide an update on their work are Lance Weinhardt, Professor of Community and Behavioral Health Promotion in UWM's Zilber School of Public Health. His work focuses on the development of HIV prevention interventions that can be implemented in resource-poor settings. Loren Galvao, a medical doctor and senior scientist in the UWM College of Nursing's Center for Cultural Diversity and Global Health. For over 17 years, before joining the UW system in 2003, Dr. Galvao worked extensively in global health, with experience in 18 countries in Africa, Asia, Latin America, and Europe. And Lucy Mkandawire-Valhmu, Associate Professor in UWM's College of Nursing and a native of Malawi. Her areas of research and expertise include community health nursing, health care of immigrants and refugees, and violence in the lives of women in Southern Africa. Welcome to International Focus.
Thank you.
Thank you for all being here. I'm wondering if you could start by giving us a little bit of overview of the context that you're working in. So what are the issues that you've encountered in Malawi, and how you've kind of gotten to this very interesting mix of HIV prevention activities, poverty and economics, and food insecurity?
Well, maybe I can take a first stab at that. My research is in HIV prevention to begin with, and I was interested in doing some work on the issue of poverty in HIV. And I was interested in doing that in an area that suffers from a lot of HIV, and sub-Saharan Africa, as you mentioned, is that place that I wanted to work. And we know from lots of correlational research that poverty is related to HIV and lots of other health outcomes. And often researchers kind of wave their hands at that and say, well, that's just the way it is. We can't do much about that. The relationship isn't actually all that well understood, how poverty exactly is related, but we know we consider it a fundamental cause of ill health. And this project came about from the desire to try to understand that relationship better, and from my background as an intervention-oriented researcher, to try to do something about that. So we began by talking about doing some work on microfinance as an intervention that could potentially have economic impacts, and we could look at the health impacts of that. And as Loren will describe a little bit more in detail, we ended up in Malawi, where the situation is poverty is extremely high. It's one of the poorest countries in the world. HIV's rate is extremely high, with about 11% in the general population, which is huge compared to the United States, for example, and other sub-Saharan African countries. And they have had a particular struggle with food insecurity. In 2006, about the time we were planning this project, they were having terrible problems with drought, and their primary food crop was corn. They were monocropping lots of corn for the commodity market, and when drought hit and wiped out their corn stores, they had serious problems with running out of food and malnutrition and starvation at that time. Fortunately,
I wonder if we could just take a pause for a second and talk a little bit about the term food insecurity. It's not one that we tend to hear a lot about in the U.S. And you mentioned, in this case, the corn market and supply being affected by the drought. What are the other dimensions? How do you think about, how do you define food insecurity?
Do one of you want to tackle that one?
Food insecurity, if you look at food insecurity at the household level, you would look at the months that people don't have food and access to food. So that would be a very short definition of food insecurity. So
people don't have access to it, or they don't have enough food, or they can't afford the food that's there. Yeah, and so that's been. How does that relate? I mean, Lucy, can you talk? Being from Malawi, I was thinking that was the reason why you're in Malawi, is because Lucy's here. But how that shows up for, say, a typical person in Malawi? How does food insecurity affect their life on a daily basis?
Well, Malawi is 80% rural, and so the majority of people are actually farmers, and they depend on rain-fed agriculture for subsistence, and they also use the commodities that they grow to then sell so that they can have cash in an increasingly cash economy. And so when rains don't fall, that becomes a major problem, and that impacts individuals, households, and their communities.
So we have. So I see food insecurity to poverty and economic development. I see as a pretty easy, natural link. Bring us back around, Lance. You mentioned that we don't exactly know all the means by which it's HIV and health is integrated with the food insecurity and the poverty. But can you talk a little bit about what you're finding there? What are the linkages now that complete that triangle?
Right. Well, what we think we see in Malawi is kind of a vicious cycle of food insecurity, people not having enough food and being malnourished. It impacts your immune system. It also impacts your kind of economic ways of life. You might do things you wouldn't normally do to get food, and places people at risk for HIV in that way. And poverty, again, not having access to resources to buy food or to provide for your other basic needs, creates these conditions where risk behavior occurs, and where also people are suffering from other illnesses that make them more vulnerable to HIV infection if they're in fact exposed to the virus. So, and then, unfortunately, when someone becomes infected with HIV, it impacts their ability to work. As Lucy said, most people are farmers, and in Malawi that means farming by hand in a field with a hoe, basically. And it impacts your ability to do that hard physical labor. Your family is then helping take care of you, and they can't be in the field as much growing food. So it has a cyclical negative effect that has really created a big public health crisis in Malawi. The average life expectancy, for example, is under 40 years old now.
So can you then move us into, so these sound like three very big problems. What do you do? How have you designed your work to, how are you grappling with these very big, difficult to manage issues?
Maybe I could step back a little bit and start talking about how this partnership came about. There are several international NGOs that are already working for many years in these issues. The challenge is that there are not many studies that evaluate these kinds of interventions, and especially for HIV. There has been a lot of studies that look at those issues, but looking at other health outcomes, such as child health, maternal health. But at HIV, when we met Lance and I in 2005, we started looking at the literature, and there were not many studies on this area. And international NGOs, although they do these kinds of interventions, they don't do long-term evaluations. So there was a major gap in the literature about this. So when we met, we started talking about which organizations we could work with. So CARE International is an international organization that addresses poverty issues in about 84 countries. And at that time, we met with them and we identified some programs that we could evaluate. So that's when we started designing this project in collaboration with this international organization, CARE.
Great. And so one of the ways you've got to, I guess, go about this work is it's got to be within partnerships. So you have CARE as a large NGO that has operations in the field. What are the other members of the partnership that you work through or you work with?
We have several members because we had to bring a multidisciplinary team. So at that time, Lance was at the medical college, then he moved to UWM more recently, and I was at UWM. My background is in medicine and public health, Lance in psychology. We also invited other investigators to work with us who had backgrounds in ethnography, like Lucy and other colleagues. And the London School of Economics also participated in this study, bringing the background in economics. The University of Malawi, having a university from Malawi is very important. Also, we have economists there. And University of Pennsylvania, also another researcher who works in ethnography and qualitative studies. So, and more recently, we brought other colleagues from Zilber School of Public Health who have other expertise. So this is a very large study, and we need several different perspectives, several researchers.
Lucy, we've got a couple minutes before the break. I'm wondering if you could start to describe a little bit about how the study itself is structured. What is it that, in fact, you are studying? How are you designing this intervention?
They focused on the intervention part, but I helped with the qualitative aspects of the study, where we did some interviews with groups of women and men who were part of the intervention study that was designed by CARE Malawi. And so we talked to women and men about their experiences with the intervention and how it affected their lives.
And what was the intervention to do with those groups?
So the general idea of the intervention is it has 4 layers. There's what's called farmer field schools, which is kind of an experiential learning method that CARE was using to teach farmers in these local villages different methods of sustainable agriculture. So they would literally set up a community plot and test out different kinds of sustainable agriculture methods like composting, plant spacing, box ridges between the rows for water conservation. And then the farmers could see for themselves which one of these worked the best, or which combination of factors worked the best, and they could take it back to their own fields and then use it. The second part was a community-based microfinance element, which is small groups of men or women get together and save money together and make loans to each other, and then pay back those loans with interest. And they could use the loans for many different things, including renting another field to increase their production, or starting some kind of auxiliary business from their farming. A third element was that HIV education and gender empowerment training were integrated into those 2 elements. It was an important piece of the content. And a fourth part was strengthening the local government and governance committees around health to make health promotion an active part of what the villages and groups of villages were focusing on. So that was the intervention itself that CARE Malawi fielded and had separate funding for, and they put that together and sent their team of people to actually deliver that intervention.
So we're going to take a break now, but as we come back, I want to pick up that story and talk about what you found when you began looking at these 4 different components. To our viewers, we'll be back in just a moment on International Focus.
The Institute of World Affairs presents our community with a range of public programs relating to global issues, U.S. foreign policy, and the world economy. For more information about the Institute of World Affairs, call 414-229-3220 or visit our website at www.iwa.uwm.edu.
Welcome back to International Focus. We're talking about HIV/AIDS prevention, food insecurity, and poverty in Malawi. Lance, before we were breaking, you laid out this sort of 4 components: the working with the farmers, working with the HIV prevention, working with the microfinance people, and I'm leaving out a 4th.
The community governance.
The community governance structures around health. So, what is it that you're finding as you look at how these, and I'm assuming it's because you're looking for how effective each of these segments are, but how they correlate with each other, is that correct?
What we're looking at is how this program that Care Malawi put together based on local need functions as a package. And so what we're doing is following people who are actually involved in this program over a 3-year period, following them and interviewing them 3 times over that period. We're also interviewing people in a separate geographical area that aren't getting this program as a control or comparison condition. And then as a separate part of the study, we are looking at the community impact of this program. So not just with people who are involved in it, but do these ideas spread through a community, which is the hope, which is CARE's idea with this. So we're interviewing from randomly selected villages people over that 3-year period, and in a control area that didn't get the program, another cohort of people. And then finally, we're doing qualitative interviews, as Lucy mentioned, with people who are just finishing their experience with the 4-level program itself to get more of a, those surveys I mentioned are all quantitative, data-based, survey-driven, whereas what Lucy's talking about is more rich, trying to get the experience of men and women who are actually involved in it.
Can you talk a little bit about what you're finding, how people describe that experience of being involved in this, what it's meaning to them as individuals?
Sure. I think one of the impacts in looking at the data, what I have found is that, for example, the Village Savings and Loan, that is a trademark of CARE, has tremendous impact on communities where cash in rural communities is very scarce. Yet people still need cash to pay school fees for their children, to buy school uniforms, to purchase food, other food commodities that they might not grow. And so, having cash within a community becomes really important. It helps in community building. It not only helps households, but it also helps the community grow together. And so women, for example, talked about how they were able to just go to their community bank as a result of this Village Savings and Loan endeavor, and they were able to take a woman who was in labor to the hospital. And we know that Malawi has one of the highest maternal mortality rates in the world. And so this is one of the great benefits of having a community bank within a rural area. So the intervention, qualitatively, our findings are that it has had tremendous impact.
And so, Lance and Loren, are you able to begin to make some preliminary conclusions or hypotheses based on the quantitative data that you're finding?
We presented some preliminary results in the AIDS International Conference recently in July, and also in the American Public Health Association meeting. So we are looking now at very preliminary data, some aspects of the data. For example, we could see that there is an increase in food security, and also these village savings and loans in these groups were able to promote more testing. Also,
so more testing for HIV specifically?
Testing, yeah, HIV testing. But this is preliminary data. We are looking at 18 months, so we still have a 36-month survey to look at. So we are looking at several aspects. We also look at maternal health, for example, from the qualitative point of view. We saw that was could be a safe venue to promote maternal health for women to go to services, both prenatal care, also emergency service. And there are other results that are being analyzed now. So we expect that next year we'll have the final results.
And in terms of sort of our big top-level findings, we presented a paper on the fact that we found a significant reduction in food insecurity in the intervention group compared to the control group over that 18-month. Both conditions improved, but the intervention condition improved much more than the controls. And HIV being one of our other main outcomes, the testing outcome was really encouraging to find that in the intervention groups, we're finding much higher rates of HIV testing. So the mainstreaming of HIV education through this program seems to be having a positive effect. And if you kind of look at it as a holistic picture, these 3 issues that we identified earlier as kind of contributing to each other, what this program, we hope, does is addresses directly the food insecurity and poverty parts of it. And those are the levers here. And if we can hopefully see an improvement in those two elements, or even one of those, it can potentially have an impact on the other two. So far we're seeing some promising results.
So if you were able to sort of continue, the next 18 months of data actually validates and expands, and both the quantitative and the qualitative data sort of confirms these hypotheses and these hoped for results. What is this going to mean for these kinds of programs going forward? I mean, what can be done with this research in the field? And I'll throw that to any of you.
We hope these finds will be able to influence programs, both from CARE, but from other organizations in Malawi, but also with Ministry of Health. In fact, we are this month we have our staff presenting the same studies that we presented at the AIDS conference. We were invited to present in Malawi, so our field staff there, they are presenting to Ministry of Health. So we hope that this will not be just exercise like a research for research, but really a research that can influence policies and programs in Malawi, and then can even scaling up to other countries in Africa and other areas of the globe. So this is very important for us, that these results will really affect change.
And I could just add a little bit to that what we set out to do with this project is not just study this one particular intervention, although we certainly want to know if it works and want to give CARE that feedback one way or the other. But to set up a paradigm where we can work with NGOs to study programs like this. This is a large-scale program that typically wouldn't be fielded by scientists and therefore not studied in a controlled way, and but at the same time is put in place all over the world all the time by NGOs, but not evaluated in a way that feeds back into the scientific literature. So we're trying to begin building a scientific knowledge base of the effects of these kinds of economic development programs on health, and this is, we view, as a first step in that journey.
So if we switch our lens from sort of the global impact to local impact, so in terms of how you, not just the research which you've been talking about, but in terms of your teaching and in terms of the working with students here at UWM, how has this project affected how you're working with students or affecting how you're teaching here at UWM?
Well, there are many different projects that are going on, in addition to these other projects. The idea of partnering with organizations becomes very, very important. We partner at the College of Nursing, for instance, with an organization that provides care to orphans and community-based orphan care. And so when we take students abroad, they're able to, to meet with children. I have a doctoral student, for example, who's working on child-headed households for her dissertation, and she's looking at the well-being of child-headed households. Yeah, so it benefits our students in that way, that we make these connections where students are able then to do research as well.
And I think we build the capacity also of faculty, other researchers here who are joining this project, and students also who have joined us throughout this project. So they're able to look at designing and other projects and learning from global experience to look at use that experience also locally. So there are ways that you can learn so many lessons from global health to local health and vice versa.
Lance, are there things that you're doing with students or ways you're bringing this into the classroom, and especially now with the new School of Public Health here at UWM?
Right, yeah, there's tremendous interest among our students, our MPH students and PhD students in global health, and I just talked about this project in my class last week, actually, and we constantly have students coming to us wanting to get involved in this work. They see the data that we've collected and how many questions could be answered. There are many dissertations in the data set that we've collected, and in general, I think it gives people an avenue, students an avenue, to feel that they're doing something about a problem. Some of these seemingly intractable problems, this kind of study design allows you to be part of that way of addressing these problems and figuring out what works rather than just knowing that poverty and food insecurity are problems in public health. So I think it's an empowering kind of approach, yet I want to emphasize that we also take a very humble approach, I think, to the work, in the sense that we have, from day one, deferred to the expertise of our partners in this project with CARE and CARE Malawi and our field scientists that actually do the surveys in Malawi. This obviously wouldn't have been done without them, and wouldn't have been done nearly as well without the incredible people we're working with across the spectrum on the project. So while it's an empowering thing to be doing something here, we were really following the lead of many others here.
We just have a few seconds left. What can people who are watching this show, what connection can they have with what's happening in Malawi? I mean, they deal with health all the time, and how does it impact, outside of the university, how does it impact people here in sort of Wisconsin?
I think there are so many problems that are similar here that I think people can relate. For example, we talk about infant mortality being so high here in Milwaukee. So there are many lessons that I think people can learn from programs overseas. So that's an example. Maternal mortality, for example, is very, very high in Malawi, much more than here. But we know that in the United States, maternal mortality has been increasing in the past 10 years. So I think they can relate to those lessons.
Great. Thank you, lads. Weinhardt, Loren, Galvao, Lucia Mkandawire-Valhmu, thank you very much for being here today and explaining Malawi to us and bringing it home to us here in Wisconsin. To our viewers, thank you very much for watching. We'll see you next week on International Focus.
For information about the Institute of World Affairs and its many programs, or to become a member of the Institute, call 414-229-3220 or visit us at our website,